and welcome to What Would Larry Do? I am Dr. Ann, and I am here with Larry Hellwig. And today we are going to do part 2 of our hair grafting saga. And for this particular session, we are actually doing it as a video. And so we just wanted to thank Star Worldwide Networks for, having us in their studio, doing the video, doing all the recording. And because we're on video today, Larry decided to, show up with a new haircut. He wanted to show off everything that's going on. So Larry, tell me a little bit about that.
I had more hair when I came out of the womb than I do now. I mean, seriously, this is like, for me, really bald. But I think, last time we talked about I was having the procedure done. I did that.
I think you had literally just had it done like 2 days before because you were in here in a baseball cap.
That's right. I had holes in my head, which I think I've had since birth. So what I decided to do was kind of get aggressive about it and take a look at, the process more. And by keeping my hair short, I can watch it grow and watch the new hairs grow, and LED and topical products that I use and all that is a lot easier. And it is so interesting getting out of the shower and doing nothing. Like a dog, I just kind of shake my head a little bit and I'm good to go. And of course, it is summertime here, so it's perfect. So anyway, I'm going to do this for, a couple months or so till it grows out, and I'm going to try it as an experiment. And I thought it would kind of fit with what I'm doing. So that's it.
No, it's actually good. Larry shaved his head. I treated my face. For both of our podcasts on videos today, we both kind of showed up doing something a little different. But we also have something special today, and I would like to introduce to you guys Matt Antonoro. He is a national trainer for Smartgraft, and he's going to be joining us today to really get into more detail about Smartgraft. So, Matt, welcome to the podcast.
Thank you so much. Thanks for having me.
Good. And so tell us a little bit about yourself.
Sure. I've been in the hair industry mostly as a consultant and a practice manager for over a decade. I like to say I've seen 1,000 heads. So I love what you guys are doing with this, and I think it's going to be really helpful for physicians and for laymen to really understand a little bit more about hair restoration, what it can do for people.
Good. And so I know Larry wanted to kind of start off this one as finishing up what we did last time, right, Larry?
Yeah, last time, we did talk about the basics and went through some of the fundamentals, and we talked about hormones and stress and all the different things that, genetics and what can cause hair loss. And we started getting into the emotion of it and what happens when you start losing your hair and how it makes you feel. Mm-hmm. And I think I mentioned that we had a testimonial from a lady named Carol who had come to us. And so what we'd like to do is play just a minute or two of that testimonial, and then we can kind of finish up the emotion component of this. But it is so powerful, because when I talk to people, and I think Matt would agree with me, that people get extremely emotional about their hair and what they're doing to try to save it or to keep it. And so if we can go ahead and play that video.
Now?
Yeah, right now that'd be perfect.
Emotionally, I was devastated. Losing my hair it was horrific. It was absolutely horrific. I had such low self-esteem, and it caused problems where I gained weight. I didn't want to do anything. I was lethargic. I didn't want to go out. I did nothing. My whole life just spiraled out of control over the past maybe 7 years. And then you guys gave me the opportunity to do this grafting, and I jumped at it because I'd done some research in the past, and I knew about the big name people that have done it, and I did research on them, and it wasn't good. But I've had friends that have had grafting done, and unfortunately they were all men. But I talked to them, and they're like, try it. It's life-changing. You've got to try it. And so I did, and no joke, it's life-changing because my hair's growing back. I feel better about myself. I'm now working out. I work out 5 days a week. I've lost 20 pounds so far. It's been 5 months. I've lost 20 pounds. My life has changed. It's like the start of everything growing and being better. Everything's getting better.
We hear that often from people once they do something.
Right. So that is, what most people don't realize that goes into part of hair loss is that emotional aspect and how it can really be life-changing for people to not only, start at the zone where, and for women out there, we kind of talked about this last time. I know men are more of the hair grafting candidates, but when a woman loses her hair, it is devastating because it's not as easy for us just to shave our head and walk around. Everybody looks at you like you must have cancer or you're going crazy like Britney Spears or something's going on, Larry could shave his head. No, they're like, oh, it's hot. It's Arizona. You just don't want to deal with hair right now. So we really appreciate Carol doing that testimonial for us because it was life-changing. She was in my chair for something else, and I was talking to her. She was getting ready to fly to Thailand to try to do a hair grafting procedure because she didn't know that it was available for women in the U.S. And that's just where, it became then passionate to me. It's always been passionate to Larry about the hair grafting, but then I'm like, really? There's all these women that don't realize they have an option? So...
And she is so grateful now because, it's changed her life. And that's what she's talking about. And you can hear the entire interview on YouTube.
Yes.
If you're interested, and everything she had to say. So, again, we're very appreciative. And I think her whole goal was to get women to understand that this is okay.
Yes.
That you can do something about it.
Yep.
And Matt, what's your experience with women and hair grafting?
Sure. I will tell you, by the way, that men are just as likely to need the tissue box during consultations. It's an emotional issue for men as well.
No, you are right. Larry's had a few that are younger that literally it's come to tears in the consultation.
Yeah. That's right.
I mean, there's a term called cognitive dissonance, which means your idea of self doesn't match what you're seeing in the mirror. And that's a psychological condition, and it causes stress. And unfortunately, stress has a great relationship with hair.
Yes.
So male or female, it ends up being this vicious circle. And it breaks my heart sometimes.
I have that problem when I look at my head right now.
Oh, gosh. Larry.
It's like, what the hell? Where to go? Oh, yeah, I did this to myself.
Gosh. I'm not going to lie. I'm not going to lie. He came in the office and I was like, what'd you do? What happened?
I had everybody doing that, and Tave thought I had cancer. It's like, what? She thought, are you dying? And so it's like, oh, wow. I may have taken it a step too far.
That's all right. Okay, but let's get back on track. So, as far as our discussion of the emotions around hair loss, I feel like that video really helps to display that. But we need to start to talk about, what people can do when they're in that, state of mind.
Right. So, Matt, when you look at this, first of all, who's a candidate and what can they do and how do they know they're a good candidate and all of that? If you could just take us through that a little bit and then maybe what the process is.
Sure. So the general rule of thumb is if there's an area here that's as good and thick as it ever was, and maybe an area here, or all three that are visibly thinner, that's a good indication that this might be a good candidate for hair restoration. Okay. Female patients tend to have a part that gets wider and wider over time, but they've still got this good, strong hair back here. Female patients may also have issues like hormones, like something, thyroid or PCOS or something else that's affecting their hair, but typically that's going to be a global situation. Mm-hmm. If we see a good, strong zone and a weak zone, that's a really good indicator. And for men, the George Costanzas of the world, that big thick hair over here and nothing up top. If he's got enough donor supply to do what he wants up here, then he's a fantastic candidate. Okay. So it's really a supply versus demand issue.
Okay. Yeah, and I think we briefly talked about last time too that I'm glad that you brought up the whole hormone issue. When we do any kind of hair restoration in our practice, we do require blood work for both men and women because we want to look at the hormones, we want to look at the nutrients, we want to make sure everything's right internally. So once they spend the money and go through the process of the procedure, that they know that they're going to have the best outcome possible.
Right. If it's something systemic that you can't address, it's a waste of the patient's time and money.
I agree. But I feel like most of it is able to be addressed, but sometimes people just don't check. So,
Yep.
So Matt, when you go through this process, and I've done a number of consultations, and the emotion obviously shows up, and we have talked about that. You look at the head and where is the hair, what's lacking, and I do use what you taught me about redwood versus birch. Would you mind going through that for us?
Sure, absolutely. Very few people are completely shiny in a particular area. So I like to use this analogy when I'm talking with patients. Imagine that you're standing on the edge of a redwood forest. And in that forest, there's 14 trees per acre. Behind you, there's a birch tree forest. Same 14 trees per acre, but you can see deeper into the forest because the trunks aren't as thick as the redwoods. Mm-hmm. So in most cases, a patient is going to get the best possible result by making these birches strong again, like redwoods, and planting more trees to get the number of hairs per square centimeter that's going to create the illusion of a full head of hair. The human eye doesn't detect thinning until you drop below 50%. So if we can get that patient back up to the 50% mark, it's going to have the same visual impact. However we do it, shaft diameter or hairs per square centimeter, everything that we do is going to go towards that final number.
And generally speaking, when we take hair from the back of the head, those are pretty much redwoods. So we're moving redwoods to where you maybe have birch, and we're trying to, of course, help at the same time the birch become redwoods. So all in all, you have increased density, and you also have increased thickness. Is that correct?
That's exactly correct.
Okay.
The non-surgical regimen of, the over-the-counter Rogaine and finasteride, PRP, laser, nutraceuticals, all of those things will help those birches become redwoods.
Yeah.
Yep.
I think it's pretty interesting, though. I always like to point this out as a statistic, is that most people don't even realize that they're losing their hair until it's down to that 50%. Like, to me, that's a huge percentage. That by the time they're noticing in the mirror, they've already lost that much hair. That's kind of scary. That freaks me out.
And the other thing is that the average male will wait up to 7 years before pulling the trigger on anything.
Oh,
so he spent 7 years brushing his teeth, hating himself. Again, back to the emotional issue.
Oh my gosh.
Yeah, I saw my hair going back, receding, getting thinner. And what was bad for me is when the staff would be working and I'm doing a procedure, so my head is down, and they're talking about the bald spots on my head.
We did not do that. The way it would happen is we'd be filming you, and we'd go back later on to look at the videos, and he's like, oh my gosh.
I like to think they were actually abusing me because they do so often. Mm-hmm. So I thought that was what was going on. But
and was there a glare issue as well?
Oh, you had to go there. The fact that they were wearing sunglasses, I don't know. Man. So anyway, it absolutely becomes an issue. And if you don't mind, could you take us through the process a little bit? Like if a patient's coming in, what's going to happen with them? What's the preparation? What do they need to go through to actually get this thing started?
Yeah, so we'll start with that preparation.
Sure. So prior to procedure day, some basic simple rules. Don't booze it up the night before. If you drink a lot of coffee.
That's where I screwed up.
Alcohol thins your blood. And this is even though it's a relatively minor procedure, it can be blood involved. So you want them to be able to clot properly. Mm-hmm. If they can avoid caffeine in the morning, that would be great too. Clean scalp so that the group has a nice clean surface to work on. And just really simply, I think we have a video we can show as well, but really simply, it's using a fine 1 millimeter punch or less to extract individual little follicular units. Okay, those are the things that grow your individual hairs. They're called follicles. You talked about it last time. And sometimes they grow in groups where you get like 2 or 3 really close together. They're extracted from here. They're counted, they're sorted, so we know exactly how many we have. And then based on the medical plan, they're actually little tiny incisions, little tiny punches, little holes, and they're literally planted one by one. It's like getting those grass plugs, if anybody out there's ever done the grass plugs. It's just literally these tiny little openings, and they're placed in one by one. Could be up to 3,000 or more grafts in a single procedure. So it's a really fascinating procedure to watch. And that's really the simplest way to explain it, is you're taking the good hair from here, not enough to look thin, and you're placing it in an area where you are thin to make you look fuller. That's really the simplest way to do it.
We do have a video of that. Could we?
Go ahead and cut to
Yeah,
that video
let's
showing
get-
the SmartGraft procedure.
Yeah.
So typically they'll mark the donor area so that they can measure how many grafts they want to take. So that's what they're doing here.
Okay.
Patient's laying down, nice and comfortable.
I slept through most of this.
A lot of guys do. A lot of guys take naps.
It was so
Now, that's
nice.
the device.
It was
It's a little
easy.
punch,
Okay.
and it literally just sucks the graft right out of the skin through that tube into the collection canister. So the great thing about this is the grafts are never exposed to open air until you're ready to count and sort. Oh, this is a good one. So that's called the drag and pull method. I love that. You can look at the graft, make sure that it's a good one, and then suck it up. And it's very close, very tedious work. But a really skilled person can pull, could be 200 or 300 in an hour.
Wow.
And that's why I don't do this procedure.
Larry doesn't
So-
have the patience to
Yeah,
sit through
I
it.
don't. So the type of technicians that do this or people that do this, I mean, we use the folks from LA that have years and years of experience, and they're doing celebrities and everyone else.
And
but,
this is the part where they're implanting them now, correct?
Yeah.
You want to talk about that a little bit, Matt?
Yeah, sure. So these grafts have been counted and sorted. We use one single hair units for the hairline because that's what Mother Nature does. And then as we go back, we start using those groupings of 2s and 3s. They're placing these in between existing hairs.
Okay.
And it's, like I say, it's very, I can't do it. I drink too much coffee. I couldn't do this.
No, the techs that have done the procedures at our office are amazing. They are so meticulous. They count everything. They look at everything. They go back and make sure it's all perfect. And that's what I was going to ask before we went to the video. But now that we got to see it, it's a good point. Is I have 2 questions for you. 1, how do you decide how many grafts to take? And 2, how do you decide where to put them?
Depends on, very often it's the physician who's making the plan and supervising the technicians. A lot of physicians will use a math approach and say, okay, this zone here is X number of hairs, X number of square centimeters. Your average density back here is this number. So we're going to need to plant this many to get you back up to that numbers per square centimeter.
Okay.
But in general, this could be like anything from say 1,500 to 1,700 grafts. Just to, like for me, I would only get a few. I'm trying to mark this properly. There we go. Just bringing it down a little bit. So that would be a relatively small number of grafts for me. But for the George Costanzas of the world, 16 to 1,800, could be over 2,000 grafts in the crown.
Okay.
Because the crown is a circle. So it's about the size of a CD, takes about 2,000 grafts.
Okay. That's a good analogy. And then I have one more quick question. So what are the abbreviations like FUE, FUT? Because I saw that on the video when it came up.
So FUE stands for follicular unit extraction or excision. The medical community changes the terms every now and then. But basically what it means is you're taking these follicles one at a time from the scalp.
Okay.
FUT was the old-fashioned way, follicular unit transplant. That method was very, very different from the one that most people are doing today, where the doctor would actually make 2 parallel incisions, rip that tissue out of the skin, close everything up hair to hair, leaving a long linear scar in the back of the head.
Yes.
That tissue is then broken up into individual little pieces and then, usually trimmed and counted and sorted. And now the placement is pretty much the same. But it's the trauma to the scalp. It's, somebody ending up with a tighter scalp after there's no such thing as surgery without a scar of some kind.
Yes.
Even the best scars are difficult to see, but they're visible.
Yes.
The great part about follicular unit extraction is we're talking about 1 millimeter or less circular scars in an area where in 2 weeks, you're really not going to be able to see anything just because you're going to have enough hair growth over that donor area that you're not going to see anything back here. And you could still go military high and tight without showing any kind of scar.
I agree.
That's off the table.
I saw Larry right after the procedure within a couple days. Again, last time we were in here doing our podcast, he was in here. The top of his head, we could tell something was done. But to be honest, the back looked fine. And I have seen those other scars afterwards, like when it's in the first week or two. And to be honest, it looks a little bit like Frankenstein.
Yeah.
Like you've had the back of your head sewn on.
And I see
There's a
them.
number of different. Oh, I'm sorry. Go ahead, Larry.
I see them in some of the consults too, and no matter how well they tried to hide them, they're there. It's very visible,
Yes.
and so yeah, I think this method, and when we were looking at systems, this was like, okay, this is so much better because, of course, I was looking at it for myself, but for everyone else, why not?
I mean, why would he do anything else other than if he wants it?
Exactly. So.
No, but that's good. I'm glad that you brought that up because I think that some men and women have been deterred from doing hair grafting because I don't think they're even aware this is an option. And of course, Larry and I being in this industry, Matt, you being in the industry forever, we've known about it for so long. We just assume that it's general knowledge, but it's not. It always blows my mind when somebody comes in for a consult and they're like, this is an option. I don't have to have a big scar in the back.
Yeah, I think too that not only do they not know or they don't understand, it was very much like Carol thinking, okay, this is only done elsewhere.
Yes, for women. It's
for
only
women.
done for women in
Yeah.
other countries, and
Yeah.
she was going to fly to Thailand.
Yeah. And so that is such a big mistake, and it's so I think sad for women to not have that understanding that they can have a full head of hair, and we will be probably doing my wife in the very near future because now that I've had it, she wants to have it. So, and I think that's exactly the way it should go is that as people start to do this and one sees another and hears another and what the process and experience was. And the experience for me was so easy. I mean, it really was.
Why don't you tell us about your experience, Larry?
Well, I slept through it.
Well, I'm pretty sure that was because you were on drugs, but No, really, tell us what it was like. I know you slept through the procedure, but kind of walk us through. You got there in the morning, what it was like during the day at lunch, and then what was it like afterwards?
I do not remember lunch. I'm sure it was very good.
I talked to him during lunch, so I know he was there. But apparently he doesn't remember.
I remember, I think Tave gave me a ride home. Is that yes? Yes. Tave gave me a ride home. So again, the drugs work. But it was nothing. I had a little wrap on my head that I kept that night. The next morning, that came off. And I think the big thing is how do you take care of so you have your donor site. Everything that you get your new hairs you want to take care of, and you want to kind of babysit that. And so how you shampoo, how you do all of that is critical. And I think the first 3 days is extremely important. And then, by day 10 or so, you're kind of on your own and you can pretty much do what you want. Is that your understanding, Matt? Is that what you teach?
Or Matt, why don't you tell us what you guide offices to do with their patients post-procedure?
Sure. Well, there's something called the 80-10-10 rule, where 80% of the patients are going to heal normally, 10% are going to heal really fast, and 10% are going to heal a little slower. Smokers tend to fall into that last group. So that's why we say if you can avoid smoking and things along those lines.
Yeah.
But generally, you can figure, give yourself a full 2 weeks just to be safe.
Okay.
After about 4 days, the healing process has seeded those grafts enough that we would actually have to excise them to pull them out.
Oh, wow.
But we
Only
still want to
4
be careful
days.
with them.
Okay.
Yeah, we still want to be careful with them. So, like I'll say, for example, that the hair washing procedure is a cup of warm water with some baby shampoo, and you just pour it over, and then you rinse, and you do that for a few days, just because you don't want to disturb those grafts.
Okay.
But between 7 and 10 days, the little scabs that are left, you can scrub those out in the shower. But you want to give it 7, 10 days, maybe even 2 weeks if you can.
So for the first 4 days, what can they not do to the top of their head? What are the guides? Are they not allowed to touch it, brush it?
Right.
Okay.
Yeah, you want to totally baby it. We also want you to keep your blood pressure, your perspiration levels pretty steady because that will help in the healing process.
So no working out?
Yeah, so I say stay out of the gym for a week.
Okay.
Second week, if you want to go back, keep it to light cardio.
Okay.
By the end of the third week, you can run a marathon.
Okay. All right. That's not too bad for patients then. But in the first 4 days is the most crucial, just barely kind of rinsing with that baby shampoo, just really taking care of your little grafts. That's pretty interesting, though. By day 4, it's like you'd almost have to excise it out. So, I mean, your body really latches onto that thing pretty quickly.
Absolutely. Absolutely. And it's all your own tissue. It's all your own material. So your body is just healing.
Yeah, because your body likes its own self, so it's going to latch onto it and try to heal it versus rejecting it.
Exactly.
Okay.
We do so many procedures at our office where we do have to baby skin and take care of it and do things like that post. So, I was thinking this was going to be a lot bigger deal. Other than just, how you shampoo, really it's nothing. You don't want to be out barbecuing your head, in the sun, which is the same sort of advice we give with all of our skin procedures. And I do know that I was very careful, like with the shampooing, baby shampoo in a cup and diluting it and pouring it over and doing that, 4 or 5 times and then rinsing it off the exact same way, just using a cup of warm water and just, that type of thing. And I think that was about 5, 6, 7 days or something like that. And then I got into it a lot more. But yeah, I mean, there wasn't that much to it. And that's what surprised me. I thought it was going to be a much bigger ordeal than it was.
And I'm not going to lie, I'm pretty shocked that you actually followed the rules to the T.
Yeah,
Because he never does this. He writes the rules for our patients to follow post-care and then does not follow them himself. This is the first time that he was like, to the T, I am doing everything they tell me.
Yeah, I actually did. I was surprised myself.
Now, for our
Larry,
patients...
did you find that, I'm sorry, Larry, did you find that you got right back to your normal activities as far as work and all of that kind of stuff? That was right away. It was just baby grass for a few days.
Yeah.
Yeah, I was back to work. Did I take the next day off? I can't even remember.
Yes, you did.
I took 1 day off, and then I was back at the clinic doing normal stuff, and it did not seem like any big deal. It really did not seem like this was a issue, it was a problem, anything like that, which I was anticipating this to be a much bigger deal. And I'd always been warning patients, just take it easy, don't do anything, And after what I went through, it was like, well, yeah, don't go work out. And I did not do a marathon. I should probably mention that. But, it really was easy. The whole process was very, very easy. Post-care was easy. And certainly you don't have to shave your head like I just did. Afterwards, you can have longer hair and grow it out, and which is what our patients have done. But it's an experiment for me, so I thought I'd try it.
So I have a couple of questions. Number one, how soon after the procedure can a patient wear a hat if they want to be able to go out in public and kind of cover up where the baby grafts are? Because I know we could definitely see those more than the back.
Yeah, I recommend you can go with the hat right away. Is there any issue with that, Matt?
As long as it's not putting pressure on the grafts, it's fine.
Okay,
In
so
fact,
it just needs to be light and lifted up off the top.
Yeah, those trucker hats
Okay.
are perfect.
Okay, all right. And then two, for women, how long before they can put their hair into a ponytail or, put like barrettes or other clips in the hair that they may use on a normal basis?
Right away, because the hairs
Okay.
that were planted are tiny and will probably actually shed in the first few weeks.
Okay.
So they're not going to be pulling any of that transplanted hair. So yeah,
Okay.
they can do that immediately.
All right, because those are things I think that patients would be concerned about, is that they would just have to leave it and they wouldn't be able to put it up. And, women, we tend to put our hairs in buns or ponytails, so then they can do all that. So if you think about that, then people
Kind
can...
of like the bun you got going now. Yeah. Okay.
But yeah, it's they can get right back to their life on a regular basis. I know my patients now see our billboard with my hair long and down, and they're like, "Wow, you look really good!" Because they never see me in anything but a bun. But I do dress up sometimes.
That's right. Okay, Matt, what are we missing out of all of this for patients? What they need to know, understand, any of that? Are we coming up short someplace? Or I want them to feel very comfortable. Physicians that are watching this, this is an easy procedure for people to be able to do, for you to be able to do in your office. You can bring technicians in and, really qualified people and have them doing it like we do. Anything else?
I would say two things that are specific to, or one thing that's specific to SmartGraft and one thing that's specific to the field. The great thing about hair restoration for a practice is the physician can choose exactly how much they want to be involved. I'm not suggesting physicians are completely hands-off, but no physician wants to spend 3 hours putting tiny little grafts in. So there are fantastic technicians for that. And it really becomes a function of how many grafts can you take in an hour, because that will mean a better result for the patient, the more grafts that you can safely take.
Okay.
The other thing, this is specific to SmartGraft. The reason why physicians are choosing SmartGraft is because there's a closed system. This is unique throughout all of the FUE devices that are out there. This is a closed system. It's vacuum. The grafts are not exposed to air. And because we can control the temperature and the humidity inside the machine, we're better preserving those grafts. In layman's terms, it's kind of like treating each little follicle like a human heart pre-transplant.
Okay.
They pack it in ice, they keep it wet, they keep it cold, they get it to the new location as quickly as possible to avoid desiccation. We're doing that with every single follicle. So the success rate per follicle is going to be higher in the hands of the same physician who's not protecting the grafts the same way.
Okay. And that would seem extremely important. If you're going to take the hairs, you want them to actually survive once you put them back in the tissue.
I was at a trade show about 5 years ago, and I think SmartGraft was at that show, and I was talking to a physician who had it, and he made a big deal out of that, and I thought, well, that's common sense. That makes perfect sense.
Yeah.
That you would do it that way. And that was the beginning of, it takes men a long time sometimes to decide on having the hair graft done.
7 years.
Yeah, it took me a long time to decide to get into this, but it's fantastic, and that works out well. So anything else that we need to know, Matt?
Yeah, whether or not you decide to get a hair transplant, a good non-surgical maintenance regimen is important.
Exactly.
If you do decide to get a hair transplant, it's even more important. And Larry, you love this when I talk with my hands.
Yeah.
If the patient is here, they come into their office because their scalp looks like this. You guys can put another round in, great. But if they don't do something to hold on to the hair that was there before they got started, that hair is still subject to thinning, and they might end up at square one.
Yep.
Yeah.
If that's their plan, if they want to come back every 5 years for another transplant, you can do that until you've exhausted their supply. That's fine, but it's got to be their choice. Most patients want to be a one and done, and your only shot is a good non-surgical plan to maintain and bring those birches back to redwood status.
Yep.
Love it.
And we teach that with everything that we do with skin. You can't just come in and get your face burned off, or you can't just go have a facelift and then do nothing for the next 20 years. Or it's like you're going to be almost even worse off than you were before because you're aging more rapidly as you get older. So we definitely teach that. And I can see that that's a big part of it is here's now that you've done the procedure, what are we doing to take care of it? So really quick before we start to get to the end, I would like to swap up some before and after photos on here because, we're talking about the procedure. Let's show what the procedure can actually do. So we should be bringing some of those up here in just a moment. So good. So here's some before and afters.
I think these might be transposed, actually. There we go. That's a better one.
Yeah. Huge difference. Look at that one right there. I mean, a big difference for that man. That's excellent, too. That's what you're talking about for, like, the George Costanzas.
Right. Framing the face makes you look 10 years younger.
Mm-hmm. So it's a big difference. If people really look at night and day difference of how it's going to make people feel about themselves, and you look at yourself in the mirror, having that before and after, waking up and seeing your hair back there, it's not thinning at the top. You're not concerned about it. That's something that I feel is a game changer. And, Carol's testimonial, that's why we showed it. It was a game changer for her. I mean, she was gaining weight before. She lost 20 pounds afterwards, purely because of the gain of self-confidence and feeling happier. made her change her entire life.
And we love game-changing type, procedures because people get remotivated. They start thinking about other things that they can do, and they get excited. And, they bring their friends along for the ride, and it's just exciting no matter what, anytime that happens. Matt, do they have any does Smartcraft have any educational programs or things like that could, benefit the physicians who might be watching?
Or
Yes,
interested
yes.
in adding this to their practice?
Sure, yeah.
Yeah. We just had a clinical webinar. So I think it was 2 weeks ago. The next one is being scheduled shortly, so they should go to smartgraft.com, and there's a button for physicians and there's a button for patients. Click on the physician button and check out the events section.
Okay.
And I think you can even access some of the older webinars as well.
Perfect.
Fantastic.
Well, good. We're getting ready to wrap up. So usually here's the point where I'll ask Larry for any last words of advice. But Matt, because you're our guest today, any last words of advice for patients or physicians that you'd like to throw out there about hair grafting?
For patients considering a hair restoration, you want to go somewhere where they're going to educate you.
Yes.
Not just come in and talk about number of grafts. That's not, it has nothing to do with patient care. It has to do with finding out what it is that you want to accomplish. For practices, this absolutely changes people's lives. A lot of people get into medicine because they're fascinated with it and they want to help people. There's so many examples of people that are now walking into a room with more confidence, are able to see themselves in a different light, and it is a life-changing thing. Medicine is about saving lives. You can save lives this way too.
Well, I agree, and thank you, Matt. We've had the exact same experience at our clinic with the patients that we have treated. They come back so excited and so motivated, and it's a huge change that takes place with them. And so, again, thank you very much for your time.
Yes, thank
Thanks
you,
for
Matt.
having me.
Thank you,
Thank you
Matt,
so
for
much for
joining
having
us today. And thank you all for joining us both on video and podcast. And we will see you next time.